So this is a concerning report. What do you think? Is it fit with what you're anticipating, just based on the number of cases we're seeing right now and then the number of states that are opening up?
Well, let me just comment briefly on the antibody test that you guys just talked about. This is a good move by FDA. They're going to clear the market of the unapproved tests that weren't that reliable. At the same time, they approved some new tests that were very reliable, including a Roche test that has 99.8% specificity. So I said yesterday that if I did an antibody test, I would repeat it maybe 3 times. Probably you'd only want to repeat a test like this twice. And you can have pretty good confidence that even a single test result may be sufficient. As far as the model that was leaked yesterday to the New York Times, what it was a model that CDC had commissioned. So CDC doesn't have modelers on staff. It doesn't have that many modelers on staff. What they do is they work with some outside academic groups to do models on behalf of the agency, and they'll give those groups data and assumptions. And in this case, they worked with a group at Hopkins that's on contract with CDC. It appears they gave them some assumptions about the reopening over the course of May that were consistent with what CDC projected that the governors were going to be doing over the month of May. And this was one of a number of different runs that the Hopkins researchers came up with predicting what could happen. So it's not at all clear that this model is really a definitive model or an authoritative model in terms of what will happen. It's one of a number of runs that the university did looking at different scenarios.
Is it, you think, a worst-case scenario?
No, from what I heard, there were some models that looked worse than this one, but I think it's an unclear scenario. I think the reality is that we can predict that cases are going to go up over the course of May. There's really nothing that's going to bring them down. As we start to reopen the economy and restart activity, people are traveling more. You saw airline travel up on Friday, the most it's been in 30 days. As all of that happens against a backdrop where there still is a lot of spread of this virus around the country, you've got to expect cases are going to go up and hospitalizations are going to go up. We don't know how much, but they're not going to go down. There's really nothing that's going to keep them from going down over the course of this month. The hope is that they don't go up a lot, but we are going to have a background of spread, and we need to figure out what that looks like, how we restart activity, get back to doing things that give us a sense of normalcy while there's still a lot of spread. And I think what it means most of all is we've got to protect those communities and those settings that are most likely to have large outbreaks. And that ends up being places where a lot of people are crowded together in things like nursing homes or institutions or even shop floors. And that's why we see the outbreaks in the meatpacking plants, because people there can't naturally social distance. They don't have proper protective equipment. Also, disadvantaged communities. We see this getting into disadvantaged communities a lot like other infectious diseases that lack access to testing, access to care, people who live in crowded housing conditions. So we need to start focusing resources on the places where this is likely to really become much more endemic.
We keep saying we need more tests, we need more protective equipment, we need more of all these things. When do you think we get to the point where, okay, we can keep up with the demand or at least feel like we are doing our very best to keep people safe?
Well, I think probably heading into June, we're going to have really robust testing. I don't think we're going to be talking about a lack of testing capacity. I think the issue going forward is going to be where can you go to get tested? And if the regulations are so onerous that doctors' offices don't want to do testing in the office because if they have a positive result, they've got to shut down the office and deep clean it and their staff needs to be quarantined, then you're going to have trouble getting access to the test because there might be a lot of testing capacity, but a lot of doctors won't be running those tests. So we need to think through those regulations right now and make sure that they make sense, that doctors' offices don't have to do extraordinary measures in order to turn over positive results in those offices. As far as the protective equipment, I think going into the summer, we're going to start restocking that as well, and there's a lot of capacity coming online. Unfortunately, we got a late start on this. So all this capacity is coming on late. But I think heading into June, we're going to see a much different situation when it comes to PPE, the personal protective equipment, and the testing capacity. So certainly heading into the fall, we're going to be in a much different posture. And that's what we're all hoping for, because I think we all feel there's a big risk that if this becomes sort of endemic through the summer, you have this smoldering infection through the summer, when you come back in the fall, you could have an ignition in a number of cases.
Hey, Dr. Gottlieb, can you just comment on this? The New York State Health Department put out an alert yesterday, which seems to be getting some traction overnight, about what they're calling a pediatric multi-system inflammatory syndrome potentially associated with COVID-19. They talk about cases of children in New York City hospitals that have had this inflammatory syndrome that they think may be related to COVID-19, characterized by persistent fever and toxic shock syndrome, and abdominal symptoms they say are common. Do you know about this?
There's been various inflammatory conditions that we're seeing in children. Kawasaki's, they talked about other kinds of phenomena that look almost like autoimmune phenomena that they believe could be triggered by this virus. So there's been reports in the literature of these kinds of conditions. And so, there was a notion that this wasn't really affecting kids. It does appear that there are kids being affected by this. We certainly know that there are children who've been hospitalized and have gotten very sick. But now it appears that there's some unusual phenomena that are affecting children, not in high numbers. These still appear to be small reports in the medical literature. But there are some unusual syndromes that children are developing, perhaps as a result of coronavirus. And so, we don't understand this virus very well. It's really a remarkable thing after so many months with the virus and so much reporting in the medical literature. We're still learning a lot about it. And I think the incremental information that we're learning leads us to believe that this is a much more fearsome virus than we perceived perhaps at various points in terms of what it's doing, its long-term consequences, its ability to infect people, how contagious it is.
It's more fearsome, definitely, especially of these anecdotal stories. And I saw about, I don't know, the latest is it can have an effect. Every day there's another effect you see, something on your extremities, purple toes, all this bizarre stuff. But if you do the math on the asymptomatic cases that we keep getting again and again and again, your mortality rate is not as fearsome as 7% or
That's
6%.
Right.
So why, when you say fearsome, I mean, don't you need to put that in as a little bit of a disclaimer that we're talking about a mortality rate that may be below 1% at this point?
Yeah, when I say fearsome, Joe, I also mean the fact that there's asymptomatic spread, that you're most contagious perhaps right when you develop symptoms or early on. Those are things that make something very contagious.
Right,
so when we think of infectious diseases that have sort of adapted to spread, this one's done that. And that's part of what I mean when I say fearsome. I mean, it's adapted very well.
When
we look at the case.
Yeah, go ahead.
Pardon my medical language, but when we look at the case fatality rate, I think in the final analysis, it's going to probably hover between 0.5 or 1%, which is what we've been saying all along.
Going to be what?
Maybe closer to 1%.
So not below 1,
I think
somewhere between a half and 1 or so.
I would think, given the literature we're looking at right now, probably close. I've been saying on your show for a long time between 0.5 and 1%. I think, given what we're seeing, it's probably closer to 1%, even if you bake in sort of 30 or 40% of asymptomatic spread. But we don't know. We don't know how much we're not diagnosing. Yeah, I think we should work on the assumption that we're probably diagnosing 1 in 10 to 1 in 20 cases. So when you see 30,000 cases, it's really 300,000.
Yeah, well, 1% is a. I don't want to do the math, obviously. That's why we're mitigating, and hopefully we'll have something to either, I don't know, antibodies or a vaccine or something, because we don't want to do 1% of any population.
We will. We'll have some therapeutics this fall.
Doctor, what are you seeing right now as the hospitalization rate? Not the death rate, because I think for most people, when it comes to confidence, it's going to ultimately be about hospitalization rate.
Right, and the number of new cases is also skewed by the fact that we're testing much more, so we're turning over many more cases. So the positivity rate's actually falling nationally, which is a good sign. The challenge is that the hospitalization rates aren't going down nationally. They're going down a lot in New York, but when you sort of back out New York from the national statistics, you still see hospitalizations going up. Now, that said, hospitalizations are a lagging indicator. They tell you what happened 7 days ago because time to hospitalization is about a week, maybe a little bit longer. But the troubling sign is that we still see them going up. And so you certainly can't conclude that the epidemic's reached its peak and is turning a corner. At best, it's plateaued. And perhaps nationally, we still are growing.
But what I'm saying is, on a very personal basis, because I think this is how people think, they say to themselves, if I get it, what's the chance I'm going to have to go to the hospital? Not what's the chance I'm going to die?
So we don't Yeah, so we don't know. It looks like it's about 10%, but it's probably going to be a little bit less than that as well once we bake in all the asymptomatic and mild spread that we're not detecting. But so far, we've been saying
10%.
about 10%
Okay.
end up getting a severe infection. Yeah.